The integrated care team provides care that was traditionally provided in hospitals, usually for the frail elderly. We are unique in the fact that we are co-located so that we can have daily, weekly and monthly conversations to ensure that the patients are getting the right care. Each professional is sitting next to each other in the office so they can have those conversations. There's no referral processes, there's no forms to fill out. They maintain their independence, they get better quicker. The patient is the core of what we do.